Hey folks, walk with me. Well, I'm in a very bug-infested part of the trail at the moment, and so you're gonna see me swatting and doing my best sort of Mike Tyson or Muhammad Ali impression. So apologies if it's really distracting. But I was thinking today about the the debate where after 9 years of having the opportunity to make plans and actually come up with something of substance, Trump said he has concepts of a plan for how he would replace the Affordable Care Act or Obamacare. And while I'm willing to giggle at that / cry about it, because of how preposterous it is, but you know that this more puts a fine point on the fact that Trump doesn't like plans. He doesn't like to actually have to know anything about much of anything other than sound bites and certainly his beloved conspiracy theories, the cats and the dogs and all that. But in any case, back to the points, you know, like I said, I'm happy to laugh at him about having a concept of a plan after 9 years, but I would also have to say, you know, there is a point to be had here that there is a grain of truth in this, in the sense of the healthcare system in this country is so far gone. It's so far down a certain path that it's tremendously hard to figure out how to claw it back into a way that brings actual value and capacity to the bulk of people, and especially to like middle class America. It's so far gone beyond that that there's a grain of it making sense, because to the degree to which he's trying to think of it in the context of how do I keep all of these insurance companies, you know, still in play, how to keep them happy, how to keep the reinsurance companies happy. There's not just insurance companies. The insurance companies have something called reinsurance. Have fun looking that up. But so how do you keep like these huge systems in place, as well as these just enormous hospital systems slash research labs, and all of the spin-offs that they have as well in terms of facilities and operations and research institutes and IP, and robotics laboratories, and you know, it's just the industry of it all is just tremendous. You can't think of it in the sense of your general practitioner and your dentist, you know, or your eye doctor or something like that. These are just tremendously powerful, and powerful because of how wealthy they are, systems that are in play. And so if you try to think of it in the context of how do we keep all of these systems sort of intact and make it more affordable for the middle class, good luck, man. Yeah, you're gonna have a concept of a plan for 900 years and never be able to bring it to fruition, because the entire premise already has too many monkey wrenches in it to be able to cross the bridge that you're trying to cross. And so, you know, having spent some time in the healthcare field, you know, and being close to folks who are still involved in healthcare, as a provider and someone who accepts insurance, or providers who accept insurance, and still being close to many people in the insurance field, I honestly don't see a great way to come up with anything beyond a concept of a plan that actually seems viable and will actually do something to make progress toward what you're proposing to make progress toward, without going back to first principles, right? Do that thing that like Elon constantly talks about, which is, go back to first principles and start thinking of it from there. And absent of that, I don't really know. Because otherwise, like I said, you are embedded and you are bogged down with all of this just sort of like ingrained systemic baggage that you're dragging around. The same systemic issues and baggage that got you where you are. And you're trying to drag those industries and those jobs and those structures and systems into the solution of why everything got so god-awful expensive and inaccessible. And I think unless you wipe that slate clean and say, we're going to have to think about things that people like to throw slogans up against, right? When you put up another idea about, well, what if we got rid of these systems and we did X, right? And then all of a sudden, certain people are just going to write you off and say, oh, you're a socialist, or you're a eugenicist, or, whatever, just sort of ad hominem attack that they want to throw your way in order to shut down your argument. We're going to have to get past that nonsense and actually just talk about what it would look like, have some actual proposals that sit outside of the realm of what's considered the norm and what's considered, I don't know, capitalistically acceptable. Because otherwise, I really don't think that there's a really viable path beyond the Affordable Care Act. And that certainly did some good things. I mean, we're talking about affordability right now, which is, it still doesn't seem affordable. But doing something as major as getting rid of insurance companies' ability to deny people coverage based on pre-existing conditions, that's enormous. If you were to go back to a system where that was allowable, I mean, talk about just setting yourself back decades and decades and decades and doing a lot of harm to a lot of people. So it did some good things, but but the name of it is the Affordable Care Act, and right? So you can talk about some of the good things that it did beyond affordability. But even if it did improve the cost to the consumer, to the end user, to the insured, I wouldn't go so far as to say that it seems as though it made it affordable to get insurance and get good, solid, reliable medical care in the United States. And so, speaking of the affordability, that's where I really think, yes, really unfortunate for his campaign and for him that he came out with, I have a concept of a plan, but the grain of truth in that is we have to get past this just desire, this seemingly birthright requirement of calling people communists and socialists and eugenicists or whatever, because they want to think of providing healthcare to people outside of the capitalist system. I don't think that there can't be, let me put this in a more eloquent way. I think that there's plenty of room for private insurance and privately insured. But I think there has to be another parallel system and solution that's provided. Otherwise, that affordable piece of the Affordable Care Act, I don't know how it should get there. Unless you just stop being afraid to put out ideas and to talk about proposals that some people are going to then shout that you're a communist. It's unfortunate, and it's really stupid, and it really hinders innovation in the sense of a societal change, right? A benefit to humanity and to the country as a whole, and especially folks who have the hardest time affording things. And I don't just mean the poorest of the poor, I mean also the middle class, right? Who make constant trade-offs to afford certain things. And then having to make that same decision in the midst of your health care, especially when it becomes important. And you're fighting your insurance company because your doctor said you need something and they reject it. They say, no, we don't think you need that. We're not going to approve covering it. Then you have to appeal while you're sick. I mean, that's sick. All right, folks. Maybe this can get something going somewhere. I doubt it, but we'll see. And I will see you in the next video.